into this really important program. District Chief Anthony Tazi is going to now speak. He's going to be spotlighted, and he's going to introduce the program and introduce the excellent speaker we have with a really great 20-minute presentation.
Good morning, everybody. Wow, am I excited. Really in for a treat. And as Dr. Vinokur mentioned, this is a first. You're going to be privy to some information of what we're doing behind the scenes, first time ever in a lot of aspects. And the gentleman that's here today, an esteemed speaker as well, Chief Coyle, I'm going to introduce in a minute. He manages our medical service division. And I wanted to open up a little bit by telling you about our important medical service division. Palm Beach County Fire Rescue's Medical Service Division oversees all emergency medical care, emergency medical training, and the mobile integrated health services for Palm Beach County Fire Rescue. The Medical Service Division continues to ensure our personnel are trained and prepared at the highest levels to provide exceptional pre-hospital care and treatment when responding to any 9/11 incident, ranging from medical calls to traumatic injuries. We collaborate with healthcare experts at a local, state, and national level to develop innovative and evidence-based medical protocols and techniques that enhance the level of patient care, which is going to lead to better patient outcomes. Our mobile integrated health team is designed to enhance these emergency medical services, the approach by assisting patients with social services and medical needs after the 911 call. In 2020, over the past year, the Medical Service Division provided EMS training for 97 of our new recruits and hosted 2 paramedic development courses that have transformed 47 state or nationally certified paramedics to highly trained Palm Beach County Fire Rescue paramedics. Continuous and ongoing training and education of our personnel remains a primary focus of our organization, and the Medical Service Division enables us to achieve this and maintain this at the highest level of care. Ultimately, the exceptional and unparalleled emergency medical care provided by our EMTs and paramedics of Palm Beach County Fire Rescue has resulted in countless lives saved and yielded an incredible positive impact on those that we served. Without further delay, please welcome me and join me in welcoming the gentleman who manages this fine Palm Beach County Fire Rescue Medical Service Division, our very own Division Chief, Charlie Coyle.
Unmute, let's see. And my display settings, I'm going to make one adjustment here and then we'll get started. Okay, Dr. Lurie, I just want to make sure, can you hear me okay?
We can hear you good.
Okay, fantastic. Thank you so much. And Chief Tazi, thank you for that excellent introduction. Really, you know, when we hear all those things, honestly, I'm just a person that's involved with a great staff and a great cast of people that we have the opportunity to work next to. So I want to dive right into the presentation because we have a lot of information to share with you today. And we're going to focus specifically on COVID-19 and some of the initiatives that we've been behind with multiple different municipalities within the county. It's really been quite a long ride over the past 10 months, and I want to just dive into the presentation and tell you about it. So we're going to start with a little timeline. You know I hear COVID-19 all the time, and then if you ask somebody what COVID or 19 stands for, where does a 19 come from? Well, the 19 originates from the year the virus started, the virus or the disease. It's actually both the virus and disease is actually in the title COVID. So it's the first documentation that we had was from the World Health Organization, the WHO, and that was on 12/31 of 2019. And really it was some pneumonia-like case that was documented in Wuhan City. So that was the first public notification that we had. If you trace that to 2 weeks later, we had 41 cases confirmed with 1 confirmed death. 1 week after that time, we had a 35-year-old man present to an urgent care clinic in Washington State with a 4-day cough and a low-grade fever that recently traveled from China. Then this bled over into Illinois at 124, again, 1 week later, and that was our second documented case within the United States. So that timeline really sets up the whole talk here today. And it's very important to understand that timeline because if you look at the national band when we stopped incoming or inbound flights from China. That started on February 2nd. But this is what Palm Beach County was doing on February 3rd. We started to cast a bigger net. We didn't focus in on China. We knew that if it was already spreading into the United States, that it really could have saturated the continent of Asia. So we casted a bigger net, and we started with our dispatch system. We sent a safety alert to all of our firefighters to make sure they were aware and practicing good hygiene, as well as utilizing personal protective gear, which I'll get into here shortly. And we reached out to the local Department of Health. We worked directly with Dr. Alonso, ensuring that we had clear notification that if we came in close contact with somebody that had this disease or virus, we wanted to make sure that we were contact tracing them even early in February, before that was really a mandate. Our dispatch center, they've played such a pivotal role in our success. In their screening process, even though the recommendation was to screen people that came from China, like again, what I said earlier, we were screening from Asia. And basically it added an additional minute to the 911 call. And we still do this today. We ask questions like, do you have a sore throat? Do you have a cough? Do you have a low-grade fever? And essentially, if you have those signs and symptoms, our dispatch center labels the call as a potential med alert. And that gives us a heightened awareness to our firefighters to make sure that we're wearing all of our proper gear, which later on transformed to we're going to wear it on every single call. But I'll explain some of the complications we had throughout that process. And this dispatch screening still occurs today, just so everybody's aware. One of the things that we noticed is we're very good at protecting ourselves with eye protection and gloves. But the CDC was recommending that we wear a face mask, we wear a gown, we wear almost like a hairnet to protect our hair, because they were unaware at the beginning on how the virus was transmitted. So it was very important for us to spend the time with our firefighters to educate them on how to put on the gear, even though they're really experts at that. One of the things that we're not experts on is safely removing the gear. So the way you take your protective gear off is just as important. And one of the key parts with this virus was to make sure that our facial covering was on throughout the process. The actual last two things to come off are the goggles and our mask. And that was very important. So that, even in February, we were focusing in on these tasks and making sure our firefighters were properly prepared for that. So if you look at the picture you see on the screen on the left, the firefighter is normal, everyday firefighter. He's got his gloves on, he's got his goggles on. And then much like Clark Kent, we turned into Superman, where we put the hairnet on, we make sure that our eyes are protected, we make sure that we have our N95 mask to make sure that we protect our respiratory system, and we make sure that we have our gowns on. Now, when I say we protect ourselves, I want to elaborate particularly on how we protect ourselves. It's not just for us. We want to make sure that we're protecting ourselves so we're ready for the next emergency. And I do want to harp on one particular topic. No matter anything you see that we've done throughout this PowerPoint presentation, none of it delayed our turnout times. None of it delayed our transport times. None of it delayed our response times. And essentially, none of it, we did not turn down any calls during this pandemic. We were there even when we were very short staffed due to multiple firefighters being quarantined, which I'll explain later. I want to share another difficulty that we had as well. If you look at the picture on the right, you see the gentleman, and it almost looks like a painter's mask. It makes it very difficult for the firefighters to communicate with the patients when we're wearing this equipment. So even though the CDC recommended that we wear this certain gear after we do our thorough screening process, we made the bold decision in late March that we were going to wear personal protective gear on all of the calls, because we knew the transmission was unpredictable. And we knew roughly that 40%, it ranged anywhere from 40 to 50%. Sometimes it was 20% asymptomatic transmission. So we wanted to make sure that we were prepared and we properly protected ourselves so we can continue to deliver that high level of service that the community desperately needed during these times and their 911 emergency. It's so important to look at the literature. When you think about COVID-19, you can see we have an article from the World Health Organization, the Annals of Internal Medicine, New England Journal of Medicine, the CDC. We can go on and on and on. But if you look throughout the course of this virus, really the literature has been, I don't want to say it's been all over the place, but there's lots of variations in the literature. So every time we make a change at Palm Beach County Fire Rescue, we look at all of the information and then we make an informed decision. So as you can see here, there's multiple pictures of how we decontaminate our gear. after every call that appears to be, that meets that med alert criteria. And then we decon the back of the rescue trucks to ensure that it's nice and safe for our next transport and make sure that we're not transmitting any virus. We definitely put the importance from the operational perspective, the administrative staff. We assembled our command team that is still present till today. We still have this command team running. We actually have weekly calls on COVID updates. And this has been led by Deputy Chief McGlenn, as well as Deputy Chief Kim Hughes. They've done an excellent job making sure that everyone stays informed, and we have a clear channel of communication to our leaders out within the community. Patient transfer. So I'm going to go ahead and fast forward ever so slightly to March 9th. This was a challenge for Palm Beach County Fire Rescue because we actually have 20 hospitals within Palm Beach County, but we knew it was important to get with each and every one of our hospital partners just to ensure that we had a safe transfer process. Because if you're a patient in the hospital and you see our crews coming in with all this gear, and then you have somebody that's potentially infected, we wanted to make sure that we were taking all of the precautions from fire rescue standpoint, as well as in conjunction with the hospital, to get that patient safely into a room without potentially infecting the rest of the ER. So our hospital partners have been paramount throughout this entire process. So all of the preparation I spoke about led to this, and we were prepared for this. So this was the first case within Palm Beach County. It was on March 12th, 2020, and it was an inbound flight from New York. Essentially, this gentleman was tested for COVID-19, and he left after the test, got in the airplane, flew back home, and as he flew back home, as soon as he landed at Palm Beach International Airport, his phone started going off. He started receiving text messages, and the text messages were telling him that he was positive. So we had to quickly establish a unified command. The Department of Health was there. The airport administration was there. Palm Beach County Fire Rescue Administration was there. While we do have units on grounds there at the airport, they were there. And essentially the Palm Beach Sheriff's Office has done an excellent job. They've been great partners throughout the process. They were there with us as well to safely extract the gentleman from the airplane, but to make sure that he got home safely and everybody else on the plane was safe as well. March 14th and March 17th, these are two important dates for us because we knew that with the transmission spreading throughout the United States, we felt it was important that we reached out to our nursing homes. We wanted to get to our assisted living facilities as well as our skilled nursing facilities, and we established a team. We looked at what the latest guidelines were from the CDC as well as the World Health Organization, and we partnered up. We put a team together, as you could see on the picture on our right-hand side. Leading the group and leading the rollout process was our licensed clinical social worker, Lauren Young. She did an excellent job. She's worked in this role she's worked in that world for a very long time, educating skilled nursing facilities. And we put together a program, and lo and behold, as soon as we put the program together, you can see the timeline above in the article. King County, Washington had an outbreak at that particular time in a nursing home. So again, we felt that we were ahead of that. And here's some of the statistics associated with this initiative. We contacted 268 of the local assisted living facilities. We coordinated with the Department of Health, the Palm Beach County Operations Center, the Healthcare Emergency Response Coalition, better known as HERC, and then the American Healthcare Association, which is ACA. ACA did an excellent job. They had reached out to many of these facilities prior to us calling. However, we still, after calling all the facilities, 68 of them still wanted us to come and visit. Some of the things that we spoke about during that visit were current facts about COVID-19, ways to slow the spread down, such as like in the nursing home where everyone kind of dines together. The recommendations early were to make sure that they were dining in the room because those have been known still to this day as super spreader events to be in close proximity and eating next to each other because you're not allowed to wear your mask at that particular time. And then I think we struck something that is ever so important right now. It's how to deal with stress and anxiety. We were talking about that early on in the pandemic. And honestly, it's something that's so important. And we need to make sure that that is always in the back of our mind, how to deal with the mental stress of somebody that receives this virus because their quarantine times, they become long and it's difficult. On the left-hand side here, we started something in March 30th called point of entry testing. And basically point of entry testing, and that was again, March 30th, is a temperature check and any associated symptomology. So at that time, we weren't talking about loss of taste or loss of smell, but we have known those are actually great. Those are definitive clues that you potentially have COVID now. So we have changed our point of entry screening multiple times throughout the pandemic. But I think one of the things to take home here is we actually do it twice a day to our firefighters. And during that process, we found 8 firefighters that were identified that had signs and symptoms. So we didn't just send our firefighters home. We sent them to our clinic. We made sure they were checked out, and then they were safely returned to their families. But more importantly, they weren't allowed to infect the rest of the fire station, which in turn it would enable them to affect the community as we responded to our 911 calls. So we made sure, still to this day, we do this. If you entered our building right now, you would have to go through this whole formal process. And I know this is throughout the county as well. April 15th and then April 17th. April 15th, this is the Emergency Operations Center. We're having a meeting with our Chief Gonzalez. You can see he's this gentleman. I'll try and highlight him real quick. He was at emergency management during that time. He's still at emergency management, as well as our division chief of operations, and he's done an excellent job. Basically, he brought the team together, and we knew, Chief Duran knew, there was going to be a community need on COVID testing. So we, again, formulated a group, and here's what we did. We came up with an action plan. We worked with the Emergency Operations Center on getting kits from the state of Florida. And we actually, on May 1st, we trained all the municipalities within Palm Beach County. So it wasn't just Palm Beach County Fire Rescue. The program we developed, we reached out to all of our municipality partners, and we offered them the training. We still to this day provide this training through a homebound style of testing, where you're able to contact the EIC, they reach out to us, and we can still come to your home every Thursday. But I do want to talk about some of the data or some of the specifics of our testing process. We started with the special needs list. So basically, if you're registered for the special needs shelter, that's the group that we targeted first under the superior leadership of Ms. Virginia Baker. And we found out that 254 did not qualify for the test. They didn't have any signs or symptoms. 83 of them qualified but refused the test. We were unable to contact 125 people after 3 separate days of phone calls, but we were able to successfully test 284. And what this led into was community testing. How do we get out into the community and test at a greater capacity? And what we did was we linked up with the Department of Health, the Emergency Operations Center, and we formulated something called PopUp Testing. So we went to all of the hotspot areas. We went to the underprivileged areas that didn't have an abundance amount of testing at that particular time, which the county has done a phenomenal job to this point. Now there's testing all over the place, secondary to the great leadership of the county administration as well as the healthcare district. But we still had this system ready to go if we need to continue to do it. But we did it for a couple of months. I believe it was 2.5 months we did pop-up testing, or 3 months. And in that time, we were able to test over 3,500 people. And again, we continue to do this through our mobile testing. This is a very telling slide. And this is just a slide I pulled from the internet. And essentially, the protective gear was definitely, it put us in an uncomfortable situation. If you watch from a nation perspective, you looked at all the nurses that were struggling, that didn't have protective gear. We actually faced a lot of those same challenges within Palm Beach County. We actually had protective gear, but the way that we had to rationalize it was very unique. And I'm going to show you an image here. We were assigning gear per employee per day to make sure that we were tracking it and had an accountable system to make sure that we didn't run out. It was a very scary time for us. Here's our pandemic protocol that we wrote. And if you look up in the top corner, I'll kind of highlight it here on 4/21. We actually, those N95 masks that we would usually wear for one time and discard of it, we were having the firefighters have to recycle the mask. They were putting it in a brown paper bag so it would be able to air dry and they wouldn't seal in whatever virus was potentially on the mask. And they were having to use it up to 3 shifts. So this was a protocol that nobody was comfortable with implementing. But honestly, at that particular time, we didn't have a choice. So again, as I spoke earlier, how important it is to put your gear on, it was very important that the firefighters understood how to take that gear off. Now we've gotten to a lot better place. We do have some inventory. I wouldn't say that we feel great about our inventory, but we've come a long way. But it wasn't from lack of effort. We were trying since January, early January, we saw this, we understood this was coming, but the national stockpile was actually getting all the gear, and they were controlling where the medical gear was going because they were doing it by the hotspots. So you can't blame them for that, but it made it very difficult when dealing with the vendors. But we had a team around the clock, a logistical team that was searching every nook and cranny of vendors to try and get us protective gear. And I'm very thankful for them. I want to highlight these two gentlemen briefly. Dr. Shepke is our medical director for Palm Beach County Fire Rescue. He is also the state medical director, and he's done a superb job. He is actually excellent. And Dr. Shepke oversees the medical care for all of the citizens. So essentially the paramedics work underneath of his license. And he is Palm Beach County Fire Rescue's medical director. The gentleman on the right side, Dr. John Villa, he's actually the department's firefighter physician. So he takes care of all of our firefighters. And I just wanted to give a brief shout out to them because they have been excellent throughout this pandemic. And one of the things that I want to talk about our protocol, when we created our certain protocol, you can see right around here where it says consider lateral or prone positioning during transport. We were actually putting patients on their left side, or I don't want to say face down because it wasn't face down, early in the pandemic, before this was even the standard of care. And now it is the standard of care. If someone that gets COVID in the hospital that's very sick, they get turned on their left side or on their back because it helps actually recruit the lung tissue in the back portion of the lung. So that's why they rotate you. This was something we were doing early on in the pandemic. We've been all over the literature, and we've been adjusting our protocols as time has went on to ensure that we're providing a premier care for the citizens, but also making sure that our firefighters are comfortable why we made the changes. We put out multiple videos through our video department. One of the things that we saw as a challenge was the hospital overcrowding. You know, if you look at Italy, or you even look in Wuhan, you look at New York, there was a lot of talk about field hospitals. During that time, we created a modified transport protocol. So this was essentially the firefighters would respond to your home. You had COVID-like symptoms, and then we had to go through this algorithm. If you had what we call minor symptoms, you were able to stay home. Now, when I say able to stay home, of course, it's always your choice, but you were able to stay home and receive additional care. What I mean by additional care is essentially the firefighters would get your contact information. They would work with our mobile integrated healthcare team. Our mobile integrated healthcare team would set up a telehealth visit with the citizen, and then we would call the citizens if they wanted to enroll in the program for 14 days to make sure their signs and symptoms were not worsening. Now, we suspended this when we watched the hospital, so we were very cautious and watching the hospital numbers to make sure that there was no overflow capacity issues. If there was a capacity issue, we would have continued to keep the protocol. But one of the things that we found out about the virus or the disease is early treatment actually was beneficial. So there's been no silver bullet that says this is the premier treatment for COVID-19. But what we found out through the steroidal treatments and some of the antiviral treatments, that if you receive them early, you would actually limit your time of signs and symptoms of the virus. So it doesn't make the virus go away, but it definitely lessens the hospitalization time if you read specifically into the literature. This group is amazing. I can't speak high. I could really honestly talk about this group for 30 minutes, but I only have about 45 seconds if I stay on track here. I definitely want to highlight this gentleman right here, District Chief Bob Kropa. He has done an excellent job, and he's led our liaison team. I'm going to take a little bit of time on this slide because it's so very important. I want you to know that Palm Beach County Fire Rescue has had 144 firefighters that have tested positive for COVID-19. We've had 1,439 episodes of quarantine. So we've had some people quarantined 2 or 3 times. And I can tell you, we've done 5,248 contact traces. So this team works round the clock, 24 hours a day to ensure that as soon as we have someone that has symptoms, they contact trace everyone around them, and we make sure that we quarantine them. Very important to us and very near and dear to our hearts are the 9 firefighters that were hospitalized. One of those firefighters were in ICU. I can proudly tell you that all of these firefighters have returned home to their families. However, we do have 4 firefighters that are still out with persistent unresolved symptoms, is what we're calling it. If you look into the literature or the journals, you'll hear the terminology called long haulers. So if you were to test these firefighters right now for COVID-19, they wouldn't have COVID-19. They would actually test negative. However, they have symptoms that stimulated from the virus. And I can tell you that there's really no clear road for redemption of this just yet, because the virus is so new. Nobody knows exactly what is the preferred treatment for those long-term symptoms. So we hope that they get better, and we're going to continue to monitor them through our liaison team. This team traces all of our positive COVID-19 interactions. So what that means is when we transport a patient to the hospital, we're unaware if they have COVID-19 or not, unless they've already been tested and tell us. Our hospital partners reach out to us, identify who has COVID, who transported them, and then our liaison team traces the firefighters to find out who had the contact and make sure that they did all the proper precautions throughout the transport. One of the things that we added was we added a feature in our reporting system that if law enforcement was on the scene and the hospital notifies us that they were the patient had COVID-19, we reach out to our brothers and sisters at law enforcement, because they've been with us from the beginning of this pandemic. Early in January, we were over at the Fusion Center having meetings with Palm Beach Sheriff's Office and the other law enforcement agents within the county. And that communication has been fantastic. Currently now we have 59 firefighters quarantined. That's an okay number. I hate to say that's an okay number, but if you understand that at one particular time we had 190 firefighters quarantined. We have 1,414 employees that are our operational folks, and 190 of them were quarantined. The interesting fact to that is we never downstaffed any of our units. We made sure that we responded to each and every emergency, and our level of service was still superior. It was excellent, and I'm very proud to say that. So we started getting bored around July. So we said, geez, what could we get ourselves into? And lo and behold, we came across a hurricane. And during that hurricane, the leadership decided to establish some of the shelters. We approximately had 5 shelters that were initiated. We staffed the 5 shelters with our normal team. When hurricanes come, Palm Beach County Fire Rescue staffs all of the shelters within Palm Beach County to make sure that we're able to provide medical care. But this one had a challenge. And the reason it had the challenge is because you had to have social distancing. You had to do the point of entry testing. And we linked up directly with the healthcare district, and we were able to provide services during the hurricane. When I spoke earlier about med alerts, this chart could be slightly confusing. And essentially a med alert just means that you have COVID-like symptoms. And if you look at the chart here, in early March, as you see, it started off very slow. And then as you can see, it's kind of just progressed over the months. And July was a very busy month for us. And I don't have all of October here, but we've had some busier days in October. So we've had over 3,000 contacts of patients that had COVID-like symptoms. This was a drill that we did with the Palm Beach Sheriff's Office, and it's very important. It was actually called point of dispensing. And this was an influenza drill exercise that we did. And the reason why we did this, we were able to administer over 330, I think it was actually 333 vaccinations to the Sheriff's Office or to Palm Beach County Fire Rescue personnel. But the purpose of us doing this drill wasn't necessarily to hand out the flu vaccination. It was to be able to get ready for the COVID-19 vaccination. So we want to be prepared to provide it to our first responders, but ultimately we want to be prepared to be partnered up with the state of Florida to be able to provide this to the community. So if we have an opportunity at being a part of distributing the vaccine, we want to be a part of it. And this is the vaccination plan. Ourselves, Palm Beach County Fire Rescue, as well as Palm Beach Sheriff's Office. Now we're in the state vaccination plan committee. And if you look on this list right here, basically you would see that there's no other fire rescue agencies on it but Palm Beach County Fire Rescue. And I'm going to make sure that they include Palm Beach Sheriff's Office because they've been our valued partners throughout this process. It would behoove me to include some facts about prevention, and I just want you to watch this quick video that came out from the JAMA network, and it was a sneeze and the particles and how far they can potentially travel from a sneeze. So this is a very quick video, but what you see here is a plume of virus, is what I would call it, coming from the nares as well as the mouth. And what they found out in this video is when somebody sneezes, that can travel approximately 23 to 26 feet. And that's very important for us to understand. And that really solidifies why it's so important to wear a mask. They did come out with a research letter just recently about oxygen saturation in patients over the age of 65. And basically all they did was they put a pulse oximeter cable, much like you would get at your doctor's office. They put it on the finger of these patients. There was 25 patients. This is not a study. This is just a research project. And what they did is every 20 minutes, they checked the oxygen saturation of that participant. And they found out with the facial covering, there was no change. Now, these patients had one comorbidity, but either of the comorbidities that they had, none of them caused shortness of breath. So there was no COPDers, there was no congestive heart failure patients. This was just specifically to see, does the face mask actually cause desaturation? Does it make your oxygen saturation go down? And the answer from this research letter is no, it does not. I put on this slide because I know there's brighter days on the horizon. It will come, but the only way it's going to come is if you remember to wash your hands. If you clean and disinfect high touch areas in your home. If you use facial coverings, again, I have mine here. I'm going to go ahead. I've taken it off for the presentation, but I have my Alliance of Del Rey mask. I'm going to go ahead and put it on for the remainder of the presentation. Make sure you wear your facial coverings. Limit your contact with big groups and really practice social distancing. As you've seen in the sneeze there, 6 feet may not be enough. Get the flu shot. The flu shot doesn't prevent you from getting COVID-19. However, the signs and symptoms of the flu are very similar to COVID-19. So if you could take that risk factor out, or you could take that symptomology out, please get the flu shot. Do your research on the vaccine. Some of the vaccines are very close to completing their phase 3 trials, and they'll be requesting from the FDA an emergency grant. So do your research. There's a couple of them that are very near. Moderna, I believe, is one of them. Pfizer's near the end, and I believe there's 3 others. But do your research and be prepared. Do you want to receive the vaccine? And here's one of the most important things. If you're not feeling well, call 911. I know there was some ambiguity and about not calling 911, and you shouldn't go to the hospital if you're sick. We're there. We're protected. I hope today I've solidified all the precautions that we've taken to provide superior service. Please, if you don't feel well, call us. Now, it's all about the thank yous, because I'm very fortunate to be on this call today. I want to thank the Alliance of Del Rey for allowing me to speak to the group. I can't thank you enough. I want to thank the leadership in Palm Beach County. County Administrator Virginia Baker is the incident commander of this entire episode, this entire incident, this entire pandemic. And she has made sure that fire rescue has had everything we needed. The communication has been clear. The goals and objectives have been clear. We're very thankful for her leadership. I want to thank our local 2928. They have been right next to us. They're our partners. They're our brothers and sisters. They've made sure that we've stayed safe throughout the process. I want to thank our hospital partners for all of their hard work. Again, 9 hospitalized firefighters, all of them safely returned to their families, some of them back to work, which is very exciting for us. I want to thank all the residents. Ultimately, you are the ones that allow us to come into your home. You allow us to take care of you. And without you, our service is nothing. It doesn't really exist at all. So thank you so much for being there for us. Thank you for allowing us to take care of you. And hopefully today we've solidified some of the initiatives that we've taken in preparation for COVID-19 and throughout the pandemic. I want to thank all the men and women behind the scenes at Palm Beach County Fire Rescue, our planning section, our finance section. There's so many people that work behind the scenes that are not on the front line that you cannot see, and they've done a superior job setting us up for success. And then I want to thank the men and women of Palm Beach County Fire Rescue. I want to thank our frontline employees. I can't say it enough. Anywhere I have the opportunity to speak, I thank them. They're heroic, what they do every day. I can't thank them enough. They do an excellent job. And ultimately, the reason why we're able to provide our services is because of you. The one last thing I do want to leave you with, as I pull up this image from Del Rey Hospital, is today is pandemic, COVID-19. Tomorrow could be another pandemic. The next day could be another epidemic. It really doesn't matter what it is. We're going to adapt, we're going to overcome, and we're going to be there for you to provide excellent service. Thank you so much. I know I went a little over my time, but I hope it was valued information, and I really appreciate this opportunity. Have a great day.